All right, and welcome back. This is our second video this month on the gut. Today specifically, the microbiome and mental health, more towards
vagus nerve, enteric nervous system, just really looking at like the gut-brain axis a little bit deeper.
Yeah, absolutely. Okay. So I think how we'll start, and like we do all these videos, this is really an open discussion we're going to have, but I want to go through some basic details, I guess, to just discuss what we really are talking about. So the vagus nerve itself, there's a great book, one of the books we highly recommend you read. It's called The Polyvagal Theory by Stephen Porges. There's another I haven't had a chance to read myself. His name is Peter Levine. He's got a great book as well that has to do with the nervous system, and specifically the vagus nerve, which is going to be a big one. Vagus nerve, let's identify it as there's an upper and a lower. There's a ventral and there's a dorsal. Dorsal, like your back, meaning the lower portion. And we have to kind of identify where the differences are. So when we talk ventral, we talk more parasympathetic. When we talk dorsal, we're talking more sympathetic, so more fight, flight. And one we don't touch on a lot is also the freeze and play dead option, which animals do. Even humans have been known to do that if you're scared enough. But that's a big one we discussed. And then when we talk about ventral, we're talking more about the parasympathetic.
And in BrainTap HRV, we can actually assess that, right? We have LF, HF, and VLF. And the VLF is that red segment, which is, you know, kind of really like the stress management segment, or otherwise known as the HPA axis, hypopituitary axis.
Absolutely.
So when someone's in that like freeze state, they're like done. You know what I mean? Like they can't fight, they can't, they definitely can't recover, and they don't have the capacity to fight or run. And they just kind of like freeze. And that's what you're referring to there.
Yeah, absolutely. That freezing option, right? Exactly. That's again in the dorsal, but in the ventral, then we start talking about that's where you socialize. That's where it's more open. That's where you want to be most of the time.
Well, you want to be in that like rest and digest state primarily, right? And most of us know that we don't live there. Most of us live in fight or flight. And then there's a group of us within that fight or flight that are in that VLF state, which essentially it's like the backup system, right? And the backup system is you just freeze. These people are paralyzed by fear, you know? And unfortunately, these are the people that, you know, they get sick and sometimes have more chronic conditions. And it sounds bad to say it's all in your head, but this is why in Western medicine, doctors are quick to look at like antidepressants, anxiety medication, because they do understand to a degree this is a byproduct of a thinking pattern, but it's not as simple as just take this pill. It comes down to, okay, well, we got to clean up the gut. Super important. We got to work with the mental emotional layers of one's headspace, which we focus on in the downward causation model.
Absolutely. And I'm glad you brought that up about doctors in Western medicine, because this is not against Western medicine, but you're right. They understand. They say the term in your head. They don't mean to make you sound like you're crazy, but they are kind of right. It's just maybe the way they're expressing it.
So like before we get into the mechanisms of the vagus nerve and how that works, you know, depending on where you are in the lessons, the PNEI system, psychoneuroendocrine immunology system, it is a biochemical system, a homeostatic system related to essentially how one's perspective to stimuli affects the meat suit, as I like to call it, or the biological system, okay? Because we have many systems. So let's say I am a firefighter and I come up on a fire and I perceive the stimuli, right? And I'm relatively used to it, for lack of better words. I am not in a fight or flight state. I'm calm, I'm settled, and I know what I need to do. So I may not be releasing as much adrenaline as a occupant of the property who sees the fire and is in fight or flight, and their system is like blowing up literally with adrenaline and norepinephrine and everything else. So that's literally how there's an entire system and science around the biochemistry of how our brain reacts to a stimuli, creating a neuroendocrine, which are brain hormones, which in turn can affect the hormonal system within the body, but also your immune system via the gut. An entire science behind it, okay?
Absolutely.
So this is why the vagus nerve is so important, because the vagus nerve, obviously being a nerve, a conductor of information, ties in with the entire system.
It does. And you know, it's funny, you just mentioned that. I wrote something down here that Stephen Porges quoted at. He says, we create our own stress markers. And most people don't even realize that they're actually stressed. They don't realize this.
You know, being a clinician working with 1,000+ people, I mean, many people over the years.
Yes.
Like it's really all about the headspace. You know, and this is why coaching is so profound. This is why clients need that like hand holding per se. And you as a practitioner, it's about creating the boundaries, of course, but part of the reason people don't succeed is because they just don't know how.
Correct.
They just don't know how, based off of the education that they've been given in terms of what society tells them and Instagram tells them and Facebook tells them and all the other bullshit that programs us in our daily life without us even knowing it.
Yes, we don't realize what it's doing, but it is. Stephen Porges talks about something called neuroception, which is walking into a room or an environment, and even though you don't realize it, that environment is doing something to your nervous system. But you're the person who says it doesn't. Correct. So you go, I don't get affected by that.
Well, you're layered with so much crap
Absolutely.
that like you're not sensitive enough to pick it up.
Absolutely.
I had a client yesterday, actually. He used to eat, and this ties in, he used to eat lectins, or like beans, lentils, and not really have issues. We did a protocol, and he went back to that, and all of a sudden he was having issues. And I'm like, yeah, because we removed a layer of crap, and you can actually feel what's happening in the system now. And that goes the same with like your ability to feel someone's energy or pick up on one's emotions. The more the deeper you go, the more you can meet someone.
The more,
or the deeper you can meet someone or feel someone.
Absolutely, feel someone.
Right?
And I know I experienced that on the physical aspect when I started my protocol almost 17 months ago, where things that bothered me, all of a sudden I was far more sensitive, which to me was a positive because it made me realize these are the things my body doesn't want.
People perceive, you know, that type of symptom or change as bad. Change is good. We're looking for change. We're looking for signs that the body is saying something to us. Because usually people, you know, they aren't really saying anything. Like, think of all the crap they're eating and they're coming to you with like, you know, my poops are fine, I just have a little bit of heartburn. I'm like, oh, like, you know, there's so much actually going on in the system.
Absolutely.
So when we're talking about the vagus nerve and the connection between the brain and the gut, you know, medical system will say this is our first brain. Like, this is the first brain.
Digestion.
The gut. Well, we really have three brains. We got our brain, we have our heart brain or heart mind.
True.
And then we have the gut brain. Okay. And your gut has more nerve endings in it than this brain.
More neurotransmitters, correct.
Generally, you'll meet somebody or walk into a situation and feel something in your gut before you have a conscious, known reason as to why you feel the way that you feel.
Gut instinct really exists.
Gut instinct exists. It's real. So we have to understand that the vagus nerve is the connection between the two. Serotonin and those happy hormones are made in the gut, up to 95%.
That's quite a bit. So that's your happy.
That's your happy hormone, right?
Happy hormone.
It's made in your gut. So we have to start at the gut when it comes to anything to do with mental health. We got to clean up the gut terrain, okay? And the vagus nerve is important. So let's get into it.
Right. So as I had mentioned, it really truly is that sixth sense. We talk about that gut instinct. It's real, whereas as children we thought, well, it wasn't real. It was you shouldn't listen to your gut. Yet I've read a lot of things where I believe you should kind of listen to your gut.
Intuition.
You really should. Intuition
I follow my gut.
It's real. Now, I want people to be careful because sometimes people want to convince themselves of things. But if you really listen to your intuition,
they're like, oh, my body's saying I need chocolate right now. I should do that.
But if they really follow their intuition, it probably is right because that is your vagus nerve, which attaches to your brain. Which, as we get into more detail throughout this conversation, we'll talk more about
and
it.
I mean, like, you know, with intuition, the ego's in there and your biochemistry, and there's a lot of layers to it. For sure, but we have to acknowledge that, you know, there is this gut instinct.
Absolutely.
For sure.
Absolutely. Okay. So let me go into a bit of the vagus nerve. This is some of the theoretical stuff, just some facts I think are important. As we had mentioned, it contributes to the autonomic nervous system. That's the parasympathetic side. That's the rest, digest. That's the state we want to be in. Let's make clear to people, though, that does not mean that sympathetic is a bad state to be in. There's a time for that. And
chronically being in that fight or flight state is when the problem occurs.
Correct.
You know, little instances are good. Like there's eustress and distress. Right?
Yes.
Eustress, good stress. Workouts, put in high pressure situations where we evolve, we change, we grow. And then there's distress when you're stuck in a chronic situation. There isn't change that's happening. You're stuck in this like repetitive cycle that you can't get out of. That's when damage starts to occur. We get adrenal, I don't want to call it adrenal fatigue, but we start to burn our adrenals out because we're not resting enough, and that causes liver issues and hormonal issues. And
and then it's what, downstream or upstream.
You're not sleeping, and
it all ties in. And this is something obviously over the next 9 months they're all going to
learn.
You realize, you'll learn, you'll start to see how all of this really starts to come together in this little section between the brain and the gut where it really all starts to happen. 10th cranial nerve, which is pretty cool, goes directly from the brain to the spinal cord. That's important. Again, it interacts with the heart, the lungs, and the digestive tract. So let's touch on that a little bit.
Well, that's part of our autonomic system, right? We can't consciously control those things. It's subconscious. It's happening on its own.
Yes.
And this is where the PNEI system comes in. I use the firefighter example, right? This is where, those systems are being run by the nervous system.
Correct.
In relation to a psychological response to our stimuli or perspective, basically, right? So this is where a firefighter versus someone who's stuck in the fire have two completely different responses in regards to how fast their heart's beating, what is their respiratory rate, and is their digestive system working or not? Right, I can tell you the person who's stuck in the fire, heart rate is like maxed out, respiratory rate's maxed out, and their digestive system is shut down.
There's because at this point there's no reason to have to be digesting. It's fight or flight, and this is important.
But people are stuck in that state chronically. I wear a whoop band, right? I have clients that tell me that like the whoop band picks up that like they did a workout and they were in a meeting. They were just in a meeting because their heart rate was so high.
Wow,
that's how stressful that meeting was. So imagine people being in that state all day long.
All day long. And two things start to happen, as we know. In that state...
And then they tell you they're not stressed.
Well, they all think they're not. But in that state, you don't heal. So systemically, that's something that's really important.
You're creating leaky gut, literally.
Leaky gut, leaky brain, leaky liver. It starts to go everywhere. So you don't heal. But even biomechanically, you don't heal physically.
You can't recover.
No, you can't recover. Whether it's from a workout, whether it's from an injury, whether it is...
You can't burn fat. You can't build muscle. Your strength isn't going up. It's going down. That overtraining, right?
Absolutely. So it gets really, really crazy. We spoke about, like I said, above and below. Above, again, is the ventral. That's where all the feeling emotions are. Below, that happens to be, of course, called the dorsal, because this is, again, your fight, flight, and as we were talking about, the playing dead, because sometimes playing dead is something that matters. Now,
playing dead is just that you're done.
Yeah, I mean,
you're just toast.
Look at an animal. When an animal chases, they play dead because no one wants a dead carcass. And I don't think I've ever seen it happen. Maybe growing up, I don't remember. Maybe once where a kid played dead in the sense of a few kids were trying to beat him up, and he just
stopped.
Just stopped because trying to fight back is actually worse. I've seen that happen. Maybe as a teenager, but absolutely, very, very, very strange. So it's not just a motor nerve. That's why we call it a visceral nerve, because of its effect on the heart and all of those important organs on the way down. It's also a sensory nerve that goes from the viscera to the brain. Again, as Jason mentioned, this is from the gut to the brain. 80% of the fibers of it, and these are some great stats here, is that it's sensory. So it's there to sense. That's what a big part of it is. I don't get into the myelinated or non-myelinated fibers. All that simply means is when they're above, they're not myelinated. And when we talk about nerve endings that are myelinated, nociceptors, like for heat and stuff, they're not. But when we talk about proprioceptors, things in joints that regulate muscle stretch and contractions, they are. So that's something you'll see a bit more of as we go along. Something cool here that I read too, that in the 50s, certain types of gastric problems, because we're going to come across people who have gastric problems, had vagotomies, where they actually did a surgical procedure where they actually disconnected the subdiaphragmatic branch of the vagus nerve. Now, just hearing that today, I think it's crazy, because it's almost like saying if I cut the nerve off, because the vagus nerve is the one that sends this information to the brain, now I no longer have a problem.
Isn't that crazy?
So very symptomatic, very...
It was used to manage the peptic ulcer disease. That sounds ridiculous.
Yeah, peptic ulcer disease, that's what it's used to manage. And
I like how the key word here is manage.
Well, because
the
nothing.
nerve has nothing to do with
Not exactly.
peptic ulcer disease. If you have peptic ulcers, essentially ulcers of the stomach, it's a microbial problem.
Right. Well, they thought, so what they said was, why would we cut the vagus nerve? Because it was related to the release and the regulation of acid secretions in the gut.
Which you need, by the way.
Well, what they're saying is, let's make the gut stop secreting these acids, which we need, by the way, in order to hopefully solve a problem, which
And so,
we can't even
we go
imagine.
into things like PPIs and, the issues with proton pump inhibitors and why decreasing stomach acid is not good. You guys are going to have all those resources. But, it just comes back to the idea of how the medical system wants to operate. And it takes it away from our bioenergetic selves, essentially.
Yeah, and again, let me make this clear. It's not about comparing certain ideologies. There's a time and a place for Western medicine.
Yes,
you need a heart replacement and liver replacement, or bones or knees or hips, like acute injuries, that sort of stuff. There's a place for it. I think, unfortunately, they've become such a reductionistic type of system, and a lot of people buy into it. It's always about symptoms. It's always about symptoms.
We've been brainwashed to want to get rid of symptoms. Symptoms, I don't know how many times I'm going to say this, but symptoms are healing mechanisms by the body. Okay?
Body screening.
Healing mechanisms. Your symptoms are your body telling you, pay the fuck attention.
Yes. Yes, well, that's...
Pay attention.
We have to be for that way, because that's exactly what it is.
That's exactly what it is. So all we do as practitioners is understand, okay, the body's saying, hey, look at me. Yeah. Great, we're looking. Now, what is it trying to tell us? Right? That's what we want you guys to become experts at. Okay, this symptom means that the body is trying to do X. And we have this amazing technology to not just guess, but actually assess the system and figure out what it needs.
Yeah. And I keep referring back to it being a visceral nerve. So like fascia, which we're going to get into more as well, the extracellular matrix, the lining of fascia has a 1:7 ratio of proprioceptors, remember the ones in joints, more mechanical, we're going to say, to interoceptors, sensory, feeling, emotion. Because this section talks about, or this section is related to mental health.
Right.
We're not mental health experts. That's what this is not about. We're talking about root causes that can affect your mental health. And of course, this means that if we have more fibers, if our body is being told mechanically, systemically, by the science and research that we're more sensory, that should tell you something. Totally. Emotions play a big role in human
relationships with your family, with
everything.
Your partner,
yes,
with your environment. Like, we are sensory beings.
And the vagus nerve is based on interoception. So again, think about anger, think about happiness, think about fear, sadness, the four major types of emotions that people can feel. Makes a big difference.
And when you talk to most people, they're experiencing these emotions like daily. Like, if I'm angry, it's like maybe once every 2 weeks. Like, it's just, it doesn't happen every day.
Yeah, I'm going to tell a bit of a story, because these are good things for people to learn.
Yeah.
For many years, I'm a little older, I've worked in a few industries before
I was angry every day.
Oh, I was angry a lot.
That's how I was a bodybuilder.
But I ended up becoming so gentle a person that I was always in such a good mood. We talk about anger. This is my days of not being angry anymore. I was always screwing around at work, playing around, joking with people. People didn't like me. They thought I was not serious enough. And I'd say, no, you guys are too serious. Life, like, my mom, God rest her soul, who passed away in 2005, if she had nothing she taught me all the years was you should be happy, you should enjoy yourself, flow with life, and taught me some of the most valuable lessons.
Right.
So it is very sensory based.
Totally.
And the better the information that we sense, even when it comes to mechanical stuff, the better the output. So even when you talk from an emotional perspective, right? You talk about how do we fix emotions? How do we fix these type of issues? Sometimes we have Reiki workers and other types of workers who can address
There's just all the layers. I got a quick story. I had a client come in, actually see me yesterday, post-cancer, post-breast cancer. Taking another round of chemo for just in case. Whatever that means.
That's what they said to her, just in case.
Just in case. Just to make sure it doesn't come back. Because, lifestyle has nothing to do with it or anything like that.
Absolutely not.
And she's in immense pain when eating. Talking about how she has so much pain. And I'm like, okay, I'm feeling around her abdomen. I'm like pushing on her ribs, which I do, like manual palpation. And which side do you think is rigid?
The side where...
Her liver is.
Her liver side.
Yeah. right? Super tight. Guess what her posture looks like?
It's funny, I was just talking to someone about that kind of posture.
Literally.
Yep.
I was like, oh, okay, right? So contraction on the liver. The fascia is wrapping everything up tight. So she does this. She's like, yeah, I like to sit like this. I'm like, yeah, because you're contracting everything. The body likes that. So I'm palpating and palpating. You know, I'm like, oh, does it hurt? You know, like, does it hurt like right there? She's like, yeah, that's where I have all my pain. What's that? Cystic carni, biggest lymph nodule. And she's like, yeah, you know, I'm telling the doctors they can't find anything. I'm in so much pain. And I'm like, guess what? They're not finding anything because there's nothing there.
Correct.
Because you think doctors assess the lymphatic system?
Well, they don't, and it's not.
Not unless you have lymphedema. And
Right,
like
unless
lymph
they
cancer or
unless they
something
think
like
there's a
that.
condition, but that's not their scope or
Nope.
even their realm to even think about it that
Nope.
way. There. So what happened with her?
Well, on top of it, she has a toenail that's falling off. So what does that
Oh,
tell you?
fungal.
Fungal, right? Guess what she eats every time she has pain? Something with sugar or
I
carbs.
was gonna say something fungal based or sugar.
Well, she's eating things
sugar.
that feed the carbohydrates, or feed the candida, sorry. The candida will create an endotoxin, poop in the system, go into the gutter, which is the lymphatic system that's already clogged up and can't get out because the liver is jammed, the spout down is
Right.
jammed
Right.
from all the past chemo and the current chemo.
So microbiome being affected, which again
Microbiome, which
affecting
affects
her
the
headspace.
lymphatic, it affects her headspace.
Yep.
She lives in fear, she's anxious all the time, ready to cry at an instance. She doesn't feel safe, of course not, because the gut is sending signals to the brain being like, yo, we're dying.
The nervous system is here to protect us. It's number one
Always.
role. And I'm glad you
Always.
just said it that way because it wasn't planned. You're right. That's her nervous system saying, please, please help. That's exactly what we're trying to say. And consider this. Your biome activates the vagus nerve, which affects your brain behavior.
So the brain is, the nervous system is telling her, like, help us, right?
Yep.
But because she's so fear-based and has this emotional layer of shame from events relating to her stepfather, she's now in a position where she's like handcuffed.
Yeah.
She literally puts herself in, and this is where people put themselves into a corner, and they know that they got to get out of the corner, but they won't do what they have to do to get out of the corner.
Yes, it is. It is unfortunate.
And there's nothing you can do. Like, you can't save anybody. They have to save themselves. And this is why, you know, we're going to be hard on you guys in the sense of, like, you guys want this. It's on you to do what you got to do. And the best way you can take care of, like, your headspace and where you want to be, your enteric nervous system, your mental health, is by taking care of your gut.
Yeah.
Just taking care of this thing.
And
okay?
we have to practice what we preach, obviously, for
Right.
a lot of reasons.
All right.
So key points, your microbiome helps you make decisions. That's your gut instinct. Your biome is responsible for tight junctions, which leads into the leaky gut,
Yep.
the permeability of the
Yep.
leaky gut, which we then know because, as mentioned, the vagus nerve is the king of communication, which goes down to your gut, which means when we have a leaky gut, that
It can
vagus
affect your
nerve is not being
headspace.
affected, which comes up to your headspace.
Right.
We mentioned about serotonin. I wrote here 90%, but whatever it is,
It's like
90 or
90,
95%,
95%.
it's a lot of it produced in the gut. Once again, back to the gut, which leads back to mental health, which
Right, and you know, the gut is healthy based off of the microbiology that's present, which is based off of the quality of the food that you're eating. The quality of the food is based off of the quality of the soil. So that entire chain is very important, and you can stick your head in the sand and ignore it, and you know, want to know why you are the way you are, or you can take responsibility. Simple as that.
absolutely.
Okay, so how can we help our vagal tone?
Fasting. Let's talk about fasting just briefly.
It's awesome. I don't think women should do crazy fasting, you know, long-term fasting all the time. I think a 3-day or 5-day fast anyone can do. You know, I think that's a survival mechanism in that. I think it's quite powerful.
Okay.
But women, I don't like going over that 12 to 14-hour fasting window.
Hormonal reason or
Hormonal, phrenic nerve in relation.
Okay.
You know, there's new research saying it's not ideally the healthiest. Like, if you're a woman, you should be eating, you should be feeding the system, just
Sure.
based off biology,
Yep.
right? But I think if you can give yourself a good 12-hour window to 14-hour window.
Okay.
I also think it could be done for like maybe, you know, 60 days, 90 days. Everyone is different, but I think prolonged intermittent fasting is not conducive for a woman's, you know, hormonal cycle, reproductive system, and things on that nature. Okay. Cold showers.
Yep.
Cold showers and breathing. That's like a Wim Hof thing written all over it.
yes.
Right? He's got a great app, actually. The Wim Hof
The Wim
app.
Hof, yep.
He's got education on there. He's got like beginner, intermediate, advanced, like you want some accountability, like there's an app for it, to be honest.
It's a great one there.
And I mean, just the mechanisms of cold showers, especially on your neck there, will down-regulate the vagus nerve. Breathing or humming,
Yes.
you know, that om,
Yep.
all of that.
Vibrations.
You know, yes, it helps to tonify
Absolutely.
the vagal nerve, or vagus nerve, and just tone things down. So a lot of benefits in that. And then obviously good food.
And good food as well, of course. Those are all play of it. Some of this we've touched
And this
on.
is like, this is simple. Like, I think this is simple. Like, you know, we should
Anybody can do
we
this.
should be focused on, you know, having good breath, right?
Yes.
Diaphragmatic
Yes.
breathing,
Yes.
okay? Understanding how to slow our breath down, right? Some people, some books you read, and this is a Czech thing, will say that healthy breathing rates or respiratory rates are in the 14 range.
Oh, yeah.
Like,
Yeah.
and that's healthy.
Yeah.
Czechs, like, they're unhealthy.
Yeah.
A healthy breathing range is actually more in the like 6-8 range,
Yeah.
maybe even 8 to 10.
I got 10
range.
actually. I was at the register holistic the dental hygienist.
Right, and she said 10.
And they actually took my heart rate and blood pressure. She goes, "You're at 10. That's pretty good." I go, "Oh, that's
sweet.
you know,
Yeah.
one breath every 6 seconds,
Right, that's
like
pretty
you know,
good. So it's
3
like
in,
3 in, 3 out.
3 out,
Yeah,
which
that's a good
which wasn't
respiratory
bad.
rate.
But you're right. The Czech Institute, believe it or not, was the first time I was ever told about breaths. Must have been 7 or 8 years ago at a conference in Toronto, and they had you test, and some people put their hand up and go, "I got 16, I got 20," and the guy who was doing the presentation said, "Sickness, sickness, sickness. You have no idea what that's doing to you."
Yeah.
I think at that time I had like 16. I thought that was pretty low, and he said, "No, that's not low at all."
Yeah, because you think about it, what's the lungs' job? It's to get CO2 out, which is a version of acidity in the system. You know, so if your system is ramped up, your respiratory rate's also going to be ramped up. And many people can't do like a 3-second in, hold 3-second out breath without like almost feeling like they're asphyxiating.
Yes, absolutely. It's
You
very,
know?
very difficult.
Like some people, when they go to take a deep breath, they're
stuck.
like
Yeah,
stuttering
yeah.
to just do that, right? They don't even know how to down-regulate. So it's very, very interesting there. And then, so breathing is important. Cold showers. I think it's cold showers, saunas. It's really about thermal regulation. It's about just challenging the thermal systems. We literally live from like 19 to 23 degrees. Like we're never outside of that range. If we're outside of that range, we're either jacking the heat up or jacking the AC
going
up.
back the other way down. Yeah.
You know, so when you're not challenging the system in a thermal regulatory stance, it's the body becomes set in this homeostasis that's this big. Which means when you're on the extremes, it can't create homeostasis. It doesn't know how, which is a problem.
You create your own markers there, absolutely.
Totally.
And you spoke about, and just to reference back, Jay spoke about the cold shower and the neck and everything. Remember, the ventral ones are all unmyelinated, which means they're to sense things like heat and cold and that kind of stuff.
Right.
That's why he mentioned the cold shower in that area specifically, which is
if you can't get an ice bath, cold shower right on the back of your neck.
Absolutely.
I know this. I have a fear. I have a fear of puking. I really don't like to vomit.
Oh, well, I knew
if I end up in that situation, cold. Cold on the back of the neck. Why? You down-regulate the vagal nerve.
Down-regulate the vagus
and
nerve.
all of a sudden, you don't have that urge to vomit.
Like I was saying earlier, that's why smiling and that sort of stuff is good for you, because that up-regulates everything. So that will put me in a better mood. Now, consider the effects on social engagement. I wrote some notes here. Anxiety, depression. The vagus nerve plays a major role in the regulation of the ventral vagus, which I said was myelinated, and dorsal vagus, which is unmyelinated or myelinated hemisphere. I mean, headspace. Like, let's talk about this in terms of how it affects, let's say, in a gathering.
Well, if you're eating primarily junk food and crap because that's how you grew up, let's just use that. Okay, so now we have a upbringing, ideology, and social mimetic that creates this situation as normal.
Yes.
Even though that's bullshit, and you know, even if it is normal, we shouldn't do it. Well, now we're going to have a microbiome problem. Okay, that microbiome problem is going to create an endotoxin problem.
Correct.
Endotoxins create basically leaky gut, leaky liver, leaky brain. Leaky brain now means you have the potential to be anxious or depressed, among other things, based off of your own personal worldviews and experienced traumas. Make sense?
Yep.
Right. Well, that entire essence is going to be because of the vagus nerve communicating upstream to the brain.
Correct.
And we also have to understand that that's going to control which part of the brain we're in. Are we in our, reptilian, root chakra, survival brain? Are we in our midbrain, which is kind of like mammalian, which is kind of like, I want to say second, third. And then we end up in the neocortex, which is like, now we're in, chakras 4, 5, 6, 7. Now we're really out of like the bottom 3, and now we're a manifestation generator. Now we can really create what we want. But you can't live in the upper 4 chakras if you're eating garbage. It is impossible from a biological, nervous, and then esoteric or energetic point of view.
And if you're wondering, we've heard again, things you hear over and over become your beliefs. Right. The reason why they don't connect them and why food might not be connected to what Jason just said is because everyone in this ideologies and Western ideologies, things are all separated.
Let me give you an example.
We know that's not the case.
So I'm on carnivore diet right now.
Yes.
Okay, meat only. I quite enjoy it, to be honest.
Yeah, I'm not surprised.
I didn't think I would, but I enjoy it.
I'm not surprised.
I feel great. My energy is great. And as you know, I've struggled for the past over a year about like working out consistently.
Yep.
And just deciding to do the carnivore diet, like attaching to like, this is how I'm gonna eat. My mood's been great, I felt great. Yep. I've been working out, right? Yep. So workout consistency, eating right, lifestyle habits are better. I'm actually meditating every day.
Yep.
I'm reading, maybe not every day, but every other day.
Yep.
I'm being better with my studies. My relationships are changing.
Yep.
My drive for work is changing.
Yep.
And I was doing pretty good already.
Yep.
But I just, we talk about quantum creativity. Paul Druin talks about that at Quantum University.
Yes.
Joe Dispenza. Like, I took a quantum leap this month in terms of how I view the world and my world. Just like that. It just switched. Yep. And it all stemmed from the decision that I just have to eat this way because I need to take care of myself to be the version I want to be.
Yep.
It comes from food.
Yep.
And it changed the microbiome, evidently, and everything else has trickled as a result of that.
So first thing we look at is digestion, which is the gut.
Take care of the gut first.
Absolutely. It's been a dream for me the last 15, 16 months, as I told you, since I originally started my protocol. Headspace, emotions, things I've learned, things that have come out of me. But food has been a big one, and like you, it's been a struggle trying to stay as active as possible the last 12 months, especially when COVID hit.
Yeah.
But all of a sudden, change the food a little, get a little more
just
active.
Decide to be consistent.
Yes, consistency.
And this is where Joe talks about, the conscious mind, right? Yeah. And how we're really lazy in the sense of like, we create excuses and da-da-da. Just make the decision that this is how it's going to be. Right? And I just had to change my viewpoint on like, if I made a decision that was more subconscious than conscious, I'm being like a little bitch in a way. Yeah. And it's okay sometimes to ebb and flow. Yep. We had a power outage.
We're human.
We had a power outage, and so we went to a restaurant and ate like what was there. Like, I'm not gonna give myself a hard time. But when you make a decision that this is for the betterment of you, you're not fighting yourself. It's like this internal motivation to just be better.
It just flows.
And if I didn't change my diet, I think it would have been more difficult, to be honest.
Yeah, I'm not surprised
at all. That's
my
perspective.
I'm not surprised at all that the diet has done that has done that for you from that kind of a diet. So you spoke on reptilian, mammalian, neocortex brain.
Yeah.
So again, reptilian brain.
So now I'm living in my neocortex.
Like right?
The things that are coming
Yes.
up because I'm living completely in the neocortex. And that's our manifestation generator right there.
Yep, that's creativity, manifestation.
All
that's
of it.
Where you go.
Higher levels of thinking.
Sometimes my wife thinks I'm nuts, and I know I told you this. I literally in the summer will spend, and now the summer's gone, I'll figure it out, but in where I am in Burlington, here in Ontario, I like to sit an hour or two by the water and just meditate and just dream and just manifest. And people think, well, that's a big waste of a day. I go, no, that's a
Not
very,
at all.
very,
That's a smart thing
that's
to
a
do.
part of the day I have to make happen. Even more important than getting to the gym, tell you
Totally,
the truth.
totally.
Like, absolutely. And that's really been a big game changer for me
It's
myself.
just visualization.
Now, the somatosensory stuff, the stuff that
Right.
controls brain and movement, is all located
Right.
in the neocortex, which you just spoke about as well, the front brain here, right?
Mm-hmm.
So the key is getting us from the animal brain to the front brain, and like Jason said earlier, things like cold showers, meditation, a lot of things we mentioned are things to help down-regulate or up-regulate, depending on where you are
Yep.
for your nervous system. But in this case, we're talking about down-regulating. So it's really, really important. Again, when you're in fight or flight, you don't heal mechanically, physically, mentally, emotionally.
And you can do all the hacks, right? All the hacks are important, okay?
Yes.
You can do all the hacks,
I'm glad
but
you're
if
bringing this
you
up.
don't get help, it sounds bad, but if you don't hire help, invest in yourself to have someone point out the blind spots that you have, you won't get where you want to get to.
Yeah, because you will not get into the complex part of the brain that you feel you're in, which is in the front where you want to be. You
Yep.
can't if you're stuck back in that reptilian brain.
Yep.
And breath is linked to our internal perception of homeostasis, because if I'm breathing
Well,
heavily,
most people that are in fight or flight are breathing in their chest.
Chest
right?
breathers,
they're,
right.
They're chest
Yep.
breathers. They're up top, so they got tight necks, and that tight necks creates this. And so, literally, your mindset can create bad posture.
absolutely. We talk about
What a
that a lot.
surprise.
Yeah, we talk about how emotions can create posture changes, how headspace can create posture changes, how the reverse can kind of happen. Obviously, we have spoken about the downward causation model in chronic disease. We will get into more things about how a stubbed toe, which is mechanical,
Right.
can lead to systemic and
Totally.
headspace issues as well. That there's definitely a time and a place when we will be getting to that. Now, when it comes to, let's say, even mechanical, breath really is what helps us
Well,
create stability in the body.
If we get that chest breathing breath,
Yep.
that fight or flight
Yep.
breath into the belly, and it's now a diaphragmatic, nice
Right.
low belly
Yep.
breath, that one massages the vagus nerve and down regulates the nervous system.
Yep.
Two, also creates intra-abdominal pressure, which is important for core stability.
Right? Which means mechanically, systemically, and mentally, it has helped you
Yep.
to understand how those things have all tied together. Absolutely.
Yep.
So I know we mentioned this before, chronic activation of the dorsal vagus, depression, poor digestion, constipation, postural weaknesses, which you just mentioned can also happen, body disassociation. Dominique, the massage therapist, she had mentioned something to me a while back, which was pretty cool. And I'm a foot guy, and I never even thought about it. But she gets her clients to have all the toes down and says, lift the big toe, lift the little toe, lift the toes in between. And to my surprise, she says, some people can't even do that. I go, you must be kidding.
People can't even lift their big toe off the ground
Well, I'm kind
without doing the whole foot.
I'm surprised. I was surprised, and I feel like an idiot saying it
should
because
not
I
be
should not be surprised.
Right.
But nevertheless, it goes to show how disassociated we can be. And if you think it's just physical, it goes way beyond that. But that's just a great example.
You're like, even just like a trap three, like pull your shoulder blades down and back. People are like,
yep. They don't understand where
like-
it is. Yeah, somatic responses, and that's
No
that's
idea.
absolutely.
Yeah,
There's a great book which, when I remember the title, it has to do with the somatic sensory system. Thomas Hanna wrote the book, and it's a fantastic book about how to get people out of postures. And that's something we'll get into more later, but about how a posture can affect obviously many other aspects of health.
Right.
But he will get into things that you can actually do to fix those imbalances. The ventral vagus is responsible for opening up the airwaves. It's associated with positive states, of relaxation and social engagement. So again, nothing new, as we've been saying. And then it's the parasympathetic. This is where you really want to be.
which is our rest and digest.
Rest and digest.
Parasympathetic is our rest and digest state where we want to be. Okay?
And I know you brought this up, but we'll maybe go into a bit more detail. So lastly, consider the other stress pathways, the HPA. I'm going to get you to mention that in just a second. That's an important pathway that has to do with cortisol and stimulation.
Yep.
Kind of briefly touch on that.
So HPA axis, hypopituitary axis, really it's like this triangle between your pituitary system, hypothalamus, and your adrenals.
Yes.
Right? And this interrelates with the PNEI, psychoneuroendocrine immunology system, basically looking at how our perception to stimuli, right, affects this homeostatic balance within our neuroendocrine system, immune system, and hormonal system, and all of this ties in with the hypopituitary axis.
Yes.
So if we are stressed out, well, then our adrenals are pumping, our pituitary is sending out different hormonal signals, and when we get locked into that HPA axis, we're dealing more with a mental stress. We're dealing more with a perceived stress than really a physiological stress or biomechanical stress.
And funny enough, though, bear in mind that chronic stress can lead to immune system. They're decreasing in how the immune system operates.
You destroy the
sleep,
gut. Well, I mean,
guts.
you destroy the gut, you destroy the liver, you destroy the brain, and at that point, any condition is possible.
And then adrenal fatigue. We hear this term a lot. Do you want to comment on adrenal fatigue? Not too much in this section, but
kind of BS.
It is.
For our world, it's a little bit. If you're with us, it's BS, right?
So that's almost like, let me interrupt, that's like, just so I can connect my world, that's like saying we have piriformis syndrome or SI joint dysfunction.
Totally. If you have adrenal fatigue, what you really have are poor sleep patterns, poor boundaries. You have poor boundaries, mentally, emotionally.
Absolutely.
You're out of alignment with who you are, and you don't know how to say no. That's adrenal fatigue.
Yeah, right there.
Essentially.
And yet,
and you're just under recovering. You're not giving your body what it needs. You're not listening to your body. So you're either creating pain as a mechanism of dealing with past pain or trauma,
right,
or you actually like the pain. Remember, the body becomes entrained in certain hormones.
Yes, it does.
Right? It likes the adrenaline, it likes the cortisol, it likes it.
Yep.
So you recreate it because you want the rush.
Yep.
Does that make sense?
It's addictive, absolutely.
Yeah, so in my world, adrenal fatigue is bullshit.
Okay.
Because it can be changed. It can be dealt with.
It can be dealt with. I know they overplay it. I'm not suggesting that it's nothing we should be concerned about.
Well, they say, oh, it's B vitamins and magnesium.
Well,
and da, da, da. Yes, you need those things. But what we really need is to move beyond this is an adrenal problem and understand that this is more of a mental and vital problem than just an adrenal problem.
Yeah, don't just throw a bunch of supplements at it.
It's lifestyle along with how we run our lifestyle.
Absolutely.
In my opinion.
Lastly, environment. I know I brought this up earlier. Neuroception, that ability to walk in an environment. Risk without requiring awareness. So you walk into a place and it's about feeling safe in a place. The clinic in Ottawa where you're at, you walk in, it has a very safe, a very comfortable feeling. I teach coaches in the fitness world as well to let them understand when you invite clients into your home or you're training them, or whether it's on Zoom or whether it's in one-on-one,
people will feel the space.
Yes, so provide a better space. Why? A better space means we get them from reptilian brain to neocortex brain to thinking brain, brain where they move better, they learn better, they digest better.
And we have that capacity to create space.
Yes.
You know, like this is a little esoteric, but you know, people feel really safe with me because they come into my like bubble, you know, my field, and I create this space where I can like kind of, I don't want to say hold them, but like energetically like hold them in a space where they can feel comfortable to express themselves the way that they feel like they should be expressing themselves. And that's really what we're talking about with space, you know, just creating this energetic space, but also clean physical space so people feel welcome.
Yes, but I was referring actually more to the energetic. Okay. Yes, clean space as well. Obviously that helps, because if they don't, they automatically kick into survival mode before they even start to see you, and already it's going to work against them and work against you. So that's obviously not a great thing. So what happens when the gut, what happens to the brain in survival mode? Hence, it affects the gut. So we go back to that connection of that vagus nerve that comes all the way down. This is why smiling, as I say, really helps to hopefully down-regulate and relax people. And people think that's funny, but because of the fact that vagus nerves, yes, that's exactly. So because those nerves are all controlled by the vagus nerve, it definitely can help. So this can be experienced in the gut. You would be, you know, remember that gut feeling we talk about, but that's also when you're afraid of something. For example, maybe you can touch on this. And I know it's probably happened to me. My wife plays in an orchestra, which not everybody knows, but you may know. And she used to get very, very nervous to the point where I remember driving her at times to her concerts. This was years ago. She'd have to go to the washroom right before. Her stomach would just want to unleash.
Anxiety, diarrhea, vomiting, peeing, you know, it's the nervous system, right?
It's funny how the nervous system.
We've always seen those movies where kids get scared and they pee their pants.
Well, there's truth to it. That's
like, and that is a very primal reptilian brain function because it's empty your bowels and go.
And go.
My dog 11, when he's stressed out, he has diarrhea poops. Like,
which
it's stress.
totally makes sense.
Right? That's how powerful our perception is. That it can totally dysregulate our body to do something that is not even normal.
It's incredible.
Right?
It really is.
You can have normal gut, normal bowel, and you can get so stressed out that you can have a watery poop.
All of a sudden, everything.
Wild.
Now, I know we don't talk about it here, but poop becomes one of the big things you look for.
Totally.
And it'll come up. You guys will see poop is a big thing.
Right.
Lastly, the enteric nervous system, intrinsic, internal, obviously. What is it? A mesh-like system of neurons that governs the function of the gastrointestinal system. Touch more. Gastrointestinal.
Gastrointestinal or our gut technically runs from our mouth to our anus.
Yes.
It's not just our intestines.
Yep.
And the nervous system is important, but when it comes to the gut, it's really a microbiology conversation.
Absolutely.
It's really about microbiology and understanding what microbes are present, and the fact that we live such clean lives away from nature, we don't have very strong microbiomes, or diverse. Strong is not the word, diverse. A strong microbiome is a diverse microbiome, and we don't have the diversity because we're not in the dirt. Over the years of industrialization and antibiotics and all the things that we're doing to destroy our microbiomes, this is why more and more of us are sick. You know what I mean? When you were a kid, the people who grew up on farms built like oxes.
Farm kids.
Never got sick.
They were the strongest. They were never sick. They never lifted any weights, but man.
Built like a brick shit house.
I knew that when we were younger, you don't want to mess around with farm kids because they were extremely powerful.
I remember we played a football team out in the boonies, and they were football, farm boys, and they destroyed us. They're just completely different type of human being.
Yeah. Absolutely.
Absolutely wild, right?
Absolutely.
And so we're just losing that diversity. And in turn, it will affect our nervous system as a result, which goes back to our brain and back and forth.
So key point I want to make here. Optimal functioning of the enteric nervous system is dependent upon proper activation of the ventral vagal and dorsal-vagal not being activated. So activate, obviously, parasympathetic, sympathetic.
So we're looking for rest and digest, not chronic fight or flight.
Yes, that's pretty much what we're saying is, exactly.
The longer that fight or flight is activated, the longer you get stuck in this reptilian cycle, this root chakra cycle or second chakra shame cycle, and you can't move energy up through the system. If you can't move energy up through the system, your manifestation generator is kind of kaput. You don't got any fuel.
Absolutely.
Something
else about the enteric nervous system, it's capable of autonomous functions like coordination of reflexes. Totally. So it doesn't always work with the autonomic nervous system, but it can. But it can work separately from it. So that's why it's important to state that. It does receive a considerable innervation from the autonomic nervous system, as I just said, but it can also operate on its own, independent of the brain and the spinal cord. So it really can kind of separate itself. It's also involved in the responses to tissue injury, so there's some involvement there. It has as many neurons as the spinal cord, which is part of the autonomic nervous system.
That's a lot.
Yeah, that's quite a bit there. Well, I'm saying the second brain. So today you touched on 3 brains.
It just depends on who you're talking to, right? We got one brain, we got a heart brain, and we got a gut brain. And what has our heart's attention being the key word, creates our intention. People are like, I have an intention of this. Well, you could want to kill somebody, but have the intention of not to kill somebody.
Exactly. So where's your attention?
Right. Absolutely. So what has your heart's attention? That's this internal drive. I'm on a mission right now, and there's no one that's getting in the way of my mission. You're either coming with me, or you're going to get knocked to the side.
Well, Lee Iacocca, who ran Ford and Chrysler many years ago, had a saying, and it was, lead, follow, or get out of the way.
That's it.
Doesn't matter which one. He didn't say there was anything wrong with any one of these persons. But either you're going to lead me, and if you can't, that's fine. Right. Then I'll follow, but choose one of the paths. Either lead, follow, or get the head all the way.
Right. So what has our heart's attention creates our intention, more with our mind than our brain.
Yep.
And obviously we have our gut as this esoteric sensing system in a way.
It is.
You know, it helps us sense our environment, what's going on, and gives us information before our brain can logically have the time to do it.
I learned from a doctor called Dr. Emily Splickle, and I have to quote her on this. She says it so brilliantly all the time. Life is sensory. It's all about sensory. It's all about, look, we're coming to an end to this particular section, but keep this in mind. We talked about the amount of nerve endings that are sensory based in the fascia, in the enteric nervous system, in everything we do. We talk about the vagus nerve, and again, it always references back to everything being sensory. It's 1-to-7 ratio, 1-to-6 ratio.
Let's use a quick example. So, you know, psychedelics are becoming more popular.
Absolutely.
Okay,
I'm invested in a company of psychedelics.
Nice. I got to do that. So
on the stock market, it's real.
well, I'm making one. I'm making a company.
Well, that's a good thing.
So if you want, reach out. The point is, psychedelics are very powerful, but they're sensory driven.
Yes.
They're driven to increase our sensory perception. So clinically, they're using MDMA, ketamine, mushrooms, LSD in clinical observation for people that are suffering from serious conditions like PTSD, schizophrenia, bipolar, anxiety, depression, you name it. And what they're seeing is that one mushroom session, one mushroom therapy session. Now, this is a macrodose, not a microdose. Can do the same amount of like 5 to 10 years of typical treatment.
Yeah, that's incredible.
How powerful is that?
It's incredible.
You know, imagine 5 to 10 years of meditation gone in one session.
Yeah.
With a licensed therapist.
It's unfortunate that those sort of, I even hate to use the word drugs, get such a bad
drugs. They're
rap.
medicinal, you know, medicinal plants, you know, these plant medicines that Mother Gaia, Mother Earth has given us. And without getting too fluffy, these psychedelics are sensory experiences.
Again.
And these sensory experiences create new brainwave patterns within the brain. And if we continue to experience those, then those nerves will wire together and our perspective will change. If you go right back to that old paradigm that you lived in, for example, you know, the light bulb was on for a second, it's flickering, and if you turn it off, well, then you're right back to where you were. Does that make sense? Right? So it's about, he's exactly right, it's about a sensory experience, positive relationships, positive friendships, dealing with the traumas in relation to your parents or past experiences, just setting yourself free of all the misery that you complain about. It can be done, and that's how you live happy and healthy.
Absolutely.
And stop creating excuses and defending why you are the way you are, because that's just your own bullshit. And on that, Coach Jay out.
Coach Kennedy out. You guys have yourself a wonderful day.